All right, so we're going to be talking about the respiratory system today. And this system is one of my favorites because it pretty much just works in sync with the cardiovascular system, which, as you could probably tell, is why we've put these back to back together to show you how this works together in an amazing way. But the primary goal in the respiratory system is gas exchange, right? So we want to bring in O2, we want to remove CO2, carbon dioxide. So again, in that way, it's really a metabolic waste removal system and an oxygen delivery system, right? So again, as you know, with my focus here, we're going to have a large exercise focus to go in with this. So with our respiratory system, oxygen becomes a pretty large thing, right? So as we exercise, we move our bodies more, we have a bigger demand for oxygen, and many times up to 15 to 20 times bigger demand than at rest. So what does the respiratory system do? It adapts by increasing ventilation rate and depth, and this also helps with, as you tend to gain more cardiorespiratory endurance, you gain more alveoli in your lungs, the bronchial tubes get stronger. Again, the system just becomes more optimized over time with that. So it's important to understand kind of the overall picture is O2 in and metabolic waste out. So we look at the anatomy of the respiratory system. There's a lot to think of. The design of this, how it's structured, is really a filtering system. Think of in your house when you have to change the air filter, right? And this is something that I actually used to do on my own for years, but when I got married many, many years ago, my wife, for some reason, liked doing this, changing the air filter. But think about it for this reason. This kind of like, again, I like the stories. What is the purpose of changing an air filter in your house, right? It gets clogged up, all the gunk in there. You get all this kind of debris and different things, and your thermostat and your AC and your heating system don't work as well without that respiratory system working now. So think about it this way, that your body is so much like the air filtration system you have. And sometimes we try to pump up, right, and optimize that air filtration system through humidifiers and different things like that, or we just provide better systems, right, so that it can optimally better. We have better airflow, right? So we have our system, our own system that does all this. We have our upper respiratory tract, which our nose and nasal cavity. What does this do? It filters what comes in, it warms it, humidifies the air. Again, thinking about in your house, you already do this. If you have an air humidifier or you're changing the air filter, a lot of our body is very similar to what happens in other machines and things that happen in our life, whether it's the car air filter, whether it's your house filter. Think about those things as similar respiratory system equivalents. And you have the pharynx and larynx, which directs airflow and also houses your vocal cords. So we know that through breathing, whether it's lower intensity exercise, moderate exercise intensity, it helps improve that humidification. It filters airflow. So expanding your rib cage as you increase your intensity, you start having mouth breathing that starts predominating, and that improves airflow. All right. So, but exercise in general, because of that need for gas exchange, it pushes that air and have more and more humidification for that. Then you have our lower respiratory tract, which is the trachea, bronchi, bronchioles, alveoli. And alveoli are just tiny sacs where this gas exchange occurs, and they're surrounded by capillaries on here. So what's the exercise connection? Regular aerobic training increases capillary density. So that around the alveoli, this improves that alveoli capillary diffusion efficiency. Again, like anything, we want the system to operate in a better manner. And one of the best ways to do this is to increase capillary density, which has a direct correlation between cardiorespiratory endurance. It's really important for that. So we look at the mechanics of breathing, which are very much focused on inspiration and expiration, right? Inspiration, expiration. So the inspiration is your diaphragm contracts and flattens. So the external intercostal, those muscles on your ribs, on the lateral portion of your ribs, they lift the ribs, which increases the volume, lung volume, decreases the pressure, and air goes in. So increases lung volume, decreases pressure, air goes in. At expiration, at rest, it's very passive, right? During exercise, it actually becomes active. So think about it. Expiration is very passive at rest. You're breathing. It's really not much going on. I'm not like pushing, blowing out. It's just kind of a very passive process. Now, when you're exercising, it becomes a very active process. Right? Those internal intercostals, which are located more immediately, and abdominal muscles force air out. So when you're at rest, you don't experience this. It's a very relaxing experience, just breathing regularly. But we know that when we exercise, this all of a sudden those internal, external intercostal muscles and the abdominal muscles are important for pushing that air back out. So inspiration, expiration. Do this with me right now. Big inhale. Big exhale. Now, you can do this sitting just like I did to mimic that exercise aspect, but deep breathing like that helps to build the musculature and those internal and external intercostal muscles. Again, I'm a big proponent of stretching that rib cage, expanding that rib cage, being out of breath once per week, at least minimum once per week. You should be out of breath. You should be forcefully expiring because of activity. What does this do? It improves the efficiency, like we talked about the alveoli sacs, the capillaries, but it improves the musculature in your rib cage, so those internal, external, costal muscles become stronger and more forceful, and so that makes it easier, more efficient to breathe during exercise, and just makes the system, again, this air filtration system, operate a lot better. So with consistent training, this becomes stronger. Your diaphragm becomes stronger, all those muscles become stronger, and they become more fatigue resistant, which is great. So let's talk about the gas exchange. So at the alveoli, you have O2 diffuses into the blood, right? CO2 diffuses out of the blood. This is driven by different concentration gradients. Begin. Remember, the purpose of this system is to pull oxygen in, CO2 out. O2 in, CO2 out, right? So what happens when oxygen comes in, it binds to hemoglobin in the red blood cells, right? This oxygen carrying capacity. Carbon dioxide is carried mainly as a bicarbonate, as HCO3, okay? So again, all you really need to know in terms of this diffusion on a higher level, and please look at the slides that go a little bit deeper in this, is that we're trying to bring oxygen in, inspire, bring oxygen in, bind that into hemoglobin, increase the ability for red blood cells to have oxygen carrying capacity, which goes over from what we're talking about, especially with red blood cells and blood there. So what we know is when we're active and we optimize our system, the training increases hemoglobin content, right? And it increases blood volume. Normally your blood volume between men and women is a range between 4 to 6 liters, right? Now, with the training effect, we can get up to 8 to 10 liters of blood. That's tremendous, almost doubling the output of blood that we have. When we have more blood, we have more oxygen carrying capacity and improves our O2 delivery. And it also increases the clearance of CO2 and then delays fatigue and improves our acid-base balance during intense effort exercise. So again, what does exercise do? It improves your ability to carry oxygen, right? That improvement in blood also improves red blood cells, so more ability to carry oxygen and better way to get rid of CO2. Remember, the purpose of the respiratory system: bring in oxygen, get out CO2. Bring in oxygen, get out CO2. You know, one of the things I think is interesting is when I'm working with clients, and I had this one lady I started about 14 years ago. We're still working together. She's so awesome. But we were doing the most basic exercise you could think of starting out. Everyone has to start somewhere. And we weren't really pushing heart rate and respiration a lot, but because she was very deconditioned, even small things had her out of breath, tremendously out of breath. She started to hyperventilate quite a bit and had to take pretty long break. And it was a surprising experience for her because, one, it had realized how poorly her respiratory system was working. Her ability to consume oxygen per milliliter per kilogram of body weight, or VO2 max, was incredibly low. She struggled to get oxygen in and get CO2 out, and therefore she felt really terrible during exercise, had to take a lot of breaks to improve that gradient. As she kept coming back throughout over time, and 1 month led to several months, led to several years. We're in year 14 or 15 now. We can do a lot more complex cardiovascular activity, and she's no longer feeling that sense of hyperventilation. Her exercise has improved her O2 delivery system tremendously. So even when she experiences some oxygen debt, her recovery is so great that she never really feels that poorly with that. So what is the lesson here is that, one, you may not feel great initially when you're trying to be more physically active, and you'll feel the deconditioning of your respiratory system because of a lack of optimization or just maintenance to the system. There has to be some level of maintenance in the system. I mean, think about this air filtration system we talked about in your home, car, and think about yourself as this too. If there's no regular maintenance or optimization, it's going to feel stagnant. So when you start to do that, it's going to feel really uncomfortable for that. So that gas exchange is really very poor, and the transport poor, and you're feeling that. When you're so far out of breath, you feel like you need to take a lot of time for that. That improves. Don't be discouraged. One foot in front of the other. All right, so let's talk about respiratory control and adaptation. So your respiratory centers in the brainstem, which are in the medulla and the pons, right? This adjusts breathing rate and depth based off of CO2 and pH levels. We have an automatic respiratory system in our brains, right? Because if it was up to us and we had to actually beat our own hearts and keep ourselves breathing, we'd all be dead. It would go very quickly with everything that's going on here. So the fact that these are controlled and that changes are made in real time through chemoreceptors, that's an amazing build for this. So we have an adjusting system, this thermostat, much like the thermoregulatory system, which causes sweating and shivering in our respiratory center. That breathing rate gets adjusted based off of chemoreceptors. Now, what we know is this through being more active, having better lifestyle habits, that especially endurance training leads to lower ventilation rates at given workloads because of improved efficiency. So what did I talk about that story? For my client, her name is Charlene, as she improved her respiratory endurance over time working with me, her ventilation rate was much lower. So she wasn't hyperventilating anymore. It was even things that were harder, because the respiratory system was way more efficient, she was able to do it and breathe at a lower rate for that. Other time, you also, an aspect of this is better CO2 clearance. For high-performing individuals, large cardiorespiratory endurance individuals, they're getting rid of CO2 very quickly, which allows you to maintain your performance and with less perceived breathlessness. This is a hard level to get to because it requires consistent training over time and progressive overload in your cardiorespiratory system. But one of the most beautiful indicators of a high-level cardiorespiratory endurance is your ability to take in oxygen and your ability to clear out CO2. Remember, this system is all about bringing in oxygen, getting rid of CO2. There's no better way to improve that system than through cardiovascular endurance training. Moderate to low-intensity training will help you have a nice maintenance-based system. Pushing yourself a little harder will allow you to feel optimal in this system as well. So let's think about, as we move to the end here, some long-term adaptations to the system. So overall, we want to increase our lung diffusion, the capacity of this air exchange. We want to strengthen those respiratory muscles, internal, external, intercostals. Expand that rib cage. Bring it in. Regularly each week, expanding your rib cage. This is why it hurts to start a new program and to improve your respiratory system, because if you're not used to rib cage expansion, all of a sudden those inspiration, expiration-based muscles are starting to get used, and it's uncomfortable doing things we're not used to. The other part of this, the adaptation of taking this filtration system, again, whether it's in your car, whether it's in your house, whether it's you, we want to improve oxygen utilization efficiency, our VO2 max. Improving our VO2 max is a critical metric for longevity in health and for quality of health. In fact, we know the data are very clear that VO2 max is almost now a vital sign, that your VO2 max has almost a direct correlation to how long you will live and the quality of your lifespan. And so what always kind of disturbs me to see when people exercising is spending so little time on VO2 max and so much time on resistance training. Resistance training is great. It's great for bone mineral density. We need this. It's incredibly important for functional capacity. But we know VO2 max is literally, if you want to look at it, the top of the food chain for this. Improving your VO2 max, which requires doing training that helps you to forcefully expand your rib cage and be out of breath once a week. This is stuff that's a little bit difficult to do, like interval training is a good example of VO2 max training. Anything that's like 2 to 3 minutes where you feel like you're struggling the last 30 seconds improves this system. And this system is directly tied to our respiratory system. So this has to be a very high priority. The other aspect of this is we're reducing ventilatory equivalent. So this just means that the body uses oxygen more efficiently. Again, I want you to think about this system much like you would think about the thermoregulatory system of heating and cooling, right? This is a very similar system in the sense that instead of this thermoregulatory system making you cooler by sweating or heating you up by shivering, this one is essentially focused on air filtration and oxygen delivery, CO2 diffusion, getting it out of your body. You want to make your air filtration system as good as possible so you decrease the opportunity for diseases related to that. Right? So what you want to know primarily is that in this system is that we want to make this less of a passive system and more of a dynamic system, right? Because the majority of what we do on a regular basis, our respiratory system operates in two ways primarily. One is this passive sitting system that we're doing right now. I'm not doing much in terms of expiration here. It's a passive thing, breathing in a little bit more, or it's being controlled by the respiratory center in the brain, in the medulla and pons, especially when you're at sleep, when you're not voluntarily controlling your breathing anymore. Again, these are more passive mechanisms. Obviously, one keeps you alive, and the other is just part of just a normal air exchange system. But these are passive air exchange systems. We want this to be dynamic. What does that take? That takes us actually performing maintenance on the system, which is usually done with low-intensity exercise or physical activity where there's really no formal progressive improvement, but there is some level of cardiorespiratory endurance. This keeps the system at least at a maintenance phase. But if you want your air filtration system to work optimally, then you're going to have to expand that rib cage pretty forcefully, at least once a week, improve your VO2 max. So that's something to think about. Last thing to think about here, let's have a question, and I'd love for you to answer it in our yellow dig. So how might respiratory muscle training or like altitude exposure, like we have here in Colorado, further enhance an athlete's performance? And doesn't have to be an athlete, just a general person's performance as well at that. So make sure you check out the slides for the rest of this topic on your respiratory system. It's a fascinating system. Again, very similar to your cardiovascular system. They work well together. But I wanted to give some deeper insight into this. And as always, how we can at least have maintenance and optimize this system versus always focusing on the chronic disease aspect of this, which you'll see plenty of that. You'll go into the slides as you get down there and discuss that. The system only works well when there's at least maintenance or there's a dynamic, forceful expiration aspect to that. Best way to do that, cardiorespiratory endurance. Okay, that's it. Thanks so much for your time, everyone, and I will see you next time.